Hello, everybody, and welcome this evening to our Facebook Live. I'm Dr. Charlotte Norton, Medical Director at the Slimming Clinic, and I'm here today to answer your questions about weight loss medication. So thank you to those who've already sent us some questions in. I've got a few here that I'm going to talk us through as we go through this live. But if you're joining us this evening and there's anything you want to ask, just go ahead, feel free, and the questions will pop through to me and I'll try my best to answer them. I'll get stuck into the answers in a minute, but we'll just give it a second to see if anybody else joins us. I can see I've already got some people joining. Yeah, obviously at the moment, weight loss medication is such a big topic. There's lots of questions people have. There's lots of information, misinformation, confusing information. So the idea is this evening I can try and answer some of those questions for you. No question is too silly, so do feel free to ask it. Or if you're not sure, if you've still got a question after this but you don't want to ask, then just get in touch with us as well. And also we've got some great offers to talk about that are available at the moment at the Slimming Clinic if you think maybe moving forward medication is the right choice for you. So what I'll do is, just before I launch into some of the questions, so I'll tell you about myself. So I'm the medical director at the Slimming Clinic. I've been working in weight loss for and slimming since 2009. So that I can't even remember now. So for a while, it's obviously always been my passion and area of medicine that I've been interested in. And wow, in that time, we've seen such a change in the tools that are available for you to use when you're looking to lose weight. And tonight we're going to focus on and talk a little bit about weight loss medication, which is one of those really useful supportive pillars when you want to get started with losing weight. So let's kick off. Let's answer a few questions. And as I say, do feel free to ask me anything as we go along. So one of the first questions we had sent in before is, what's the difference between Mounjaro and Wegovy? So let's dive into that one. So both Wegovy and Mounjaro are two types of injectable weight loss medication that's available. Now, injectable weight loss medication has been available since about 2017, when the first injectable medication, Saxenda, came to the market. So some people might have heard of that. That was, again, a fantastic weight loss tool, but it was a daily injection. Next, the next injection that came to market is a medication called Ozempic. And now lots of us have heard about Ozempic. We still hear about Ozempic, and it's still a valid medication in use, but its license is for the treatment of diabetes, not weight loss. So what the drug companies did is, obviously they've got Ozempic, they're treating people for diabetes with it, they're losing weight. They brought out a sister pen called Wegovy, which is the one that's licensed for weight loss, and it goes to a higher dose than Ozempic does. So Wegovy is the version of Ozempic that is for use in weight loss. It goes to a higher dose, and it contains the active medication in it is called semaglutide. So these are a weekly injection. So it moved on from being a daily one that we had right back with Saxenda to now being a weekly injection. So much easier to manage than injecting yourself daily. And semaglutide, or Ozempic and Wegovy, are GLP-1 agonists. That's quite fancy, and we hear about GLP-1s, and essentially that is the name of the hormone they mimic in the body. So when we eat normally, our bodies are in tune to knowing when food's entered our stomach, and our stomach usually, and our gut releases a hormone that feeds back to the appetite center of the brain, and that hormone is called GLP-1. But normally it only lasts a very short time, quite transiently, after we've eaten. So what has been done with these medications is they've modified that hormone ever so slightly to make it constantly present. So you inject yourself with it and it remains in your system. So it's constantly feeding back to the brain that you feel less hungry, that you've got less appetite, and therefore you can think a little bit less about food and take a step back, think about what you're going to eat, maybe plan a little bit better. But secondary, what they also do is they slow down how quickly food moves through your gut. So again, that creates that feeling of fullness. So you might find that your portion size goes down because just naturally you're feeling fuller when you're eating, so you'll eat less. So you've got the two ways in which this type of medication helps you manage your weight loss by adjusting what you eat. Now, we know that weight loss is not easy. You know, we specialize in helping people here. We know that diet is a key part, but not the only part. But this is how these medications work. They help with that diet part of losing weight. So then what's Mounjaro? So Mounjaro is the newest injection that's come to market, and it contains an active medication called tirzepatide or tirzepatide. I never know if I quite say it right. Everyone says it a little bit differently, but that's the name of the medication within it. Now, like semaglutide or Wegovy, it's a GLP-1 agonist, so it's a copy of that hormone, but it's also another hormone called GIP, and that means we've got two different gut-based hormones feeding back to the brain in a similar way, reducing perception of hunger, and also telling the gut that it's fuller, slowing down that transit, and therefore making you feel fuller. So they work very similarly in terms of their mechanisms of action and how they activate the innate pathways we've got in our body anyway that say we're full and that we've eaten enough, but amplify them up so that it helps us again manage that diet part. So again, they've both been available for differing times, but what we know is when a new medication like this comes to market is we have all the information from the clinical studies that have been done before it's released, so we can see the great results that they've had in clinical studies. Plus, we're seeing fantastic results in patients that have been using the medication since their launch, and that's the key. So the key difference between Wegovy and Mounjaro is they contain different drugs. They're of a similar class. They're like brother and sister, but they're not exactly the same. So they both work in a similar way. And which one is right for you is dependent. There's no one that's best for you. It depends on lots of individual factors, and some people might find that they try both in their journey in weight loss. They might use one for a while and then may even change to the other. One might work better, one they might tolerate better, so you might find it you feel better on it than the other. And again, it's not always possible to predict. Sometimes it is a little bit of get started and see which one suits you. But what's great is that we've got several available tools now that can help you find the right medication for you. And alongside that, which is another question we got, is why do they come in different doses? And again, the dose you take again is dependent. Some people so the way they work is you start on the lowest dose. You must always start on the lowest dose if you're starting a GLP-1 medication, because of those effects on the gut, especially that slowing down the gut transit. If you were to launch yourself in at a higher dose than the lower dose, you'd find you would suffer with quite well, I don't want to say severe, but you would suffer badly with side effects from the medication because your gut hasn't had a chance to get used to it in a gradually increasing way. So you must always start at the bottom, and that therefore means you've got better chance of making sure that you tolerate it and that it works for you. But what's important to know is it doesn't, by starting at the lowest dose doesn't mean you're not going to start losing weight and have appetite control. You start losing weight from the beginning and you go up in dose by several factors. Number one is how you're progressing. Are you losing weight well? Are you doing well on that lower dose? If you are, and you've got no side effects, sometimes you don't have to step up straight away. You might repeat the same dose again. Some people might find actually on the lower dose that they're not got enough appetite suppression. They still don't feel quite in control, and they might feel like they're ready to go up. So they'll move to the next dose straight away. You might, on the dose you're on, you might still have some niggling side effects. It's quite common with these medications to maybe feel a bit nauseous sometimes. Sometimes it upsets your bowel motions. They might be a bit loose, or you might be a bit blocked up. So again, if you've got a niggly side effect, something that hasn't quite settled, then again, that's a reason to repeat the same dose, give your gut that little bit longer to get used to it, and then go up. So there's lots of reasons why you might adjust and go up and down in dose. Some people might stay on the lowest dose for quite a while. Other people go up quickly. It's not a race. It's all individual. The key here is to be losing weight in a sustainable and safe way, and for you to be feeling in control of what you are doing and how you're managing your weight loss program. So that's what's important. And what we have at the Slimming Clinic is a team of doctors and dietitians and a team that have been working in weight loss for several years that understand this and can help you understand how best to take your medication, because we all know that there's a variety of places you can go now to find this type of medication, and you don't always get the support that really will make that difference. Because if we're taking a medication that reduces our appetite and we're eating less, it may just be that we're just eating less of what we were eating before. Now, you will lose weight by simply eating less if we think of the simple science of how to lose weight, less calories in. But if you're not changing up what you're eating, if you're not looking at making sure you're getting all the nutrients you need. Because if you're eating less and you're not getting all the nutrients, you might find that you start to struggle with symptoms because you're missing out on some key nutrients. So you've got to pair this medication up, this investment you've made in yourself, this investment you've made in the time and the money, you know, of sourcing this medication. If you bought it in the private sector, you've got to team that up with making those correct changes to those other pillars that support it. And what we do at the Slimming Clinic is we bring that together for you. We work on how and what areas of support you need the most of, to make sure you've got all the tools to get the most out of your medication and your treatment. Now, that brings me to say something about a really exciting offer we have at the moment. We've just launched, or we're imminently launching, our Slimming Club. And this is our membership area. This is a fantastic resource where we've got information from all our specialists, recipes, community areas. There'll be lots of lives and information on there, lots of ways to look at eating, especially dependent on the medication you're taking and your own lifestyle choices. And at the moment, we're offering 60 free places to our membership area. So if you're interested, then absolutely have a look in the comments. There'll be a link on how you can register your interest to join that. And that again helps to give you all the support you need. Now, we feel that support alongside the medication is so important to get the most out of it, that you can join our Slimming Club even if you are not sourcing the medication from us. If you're getting your medication elsewhere, you are still eligible to come along and join our Slimming Club membership, because we know how important it is to be getting and looking at all those other areas to get the best results out of your medication. So let me, and you please do feel free to ask any questions if anything I'm saying is a bit too fast, or if I've not explained it very well, or you've got anything else to ask. But if not, I'll move along to the next question that I was sent beforehand. Somebody says, do I need to take my injection at the same time every week? It's a good, you know, talking about how we take the medication and when we take it is really important. So it is an injection you take every week. We usually recommend you find the time that suits you and you stick to that time each week. So some people might prefer to do it first thing in the morning because that's their sort of daily routine. Other people might prefer to take it at nighttime. Sometimes those who feel a little bit nauseous after taking their doses might find it suits them better at nighttime when they're sleeping. It doesn't matter. It's just ideal that you sort of stick to the same time each week, because the medication lasts. The way the pen's been designed and the way the medication is metabolized and eliminated in your body is that to get the ultimate or the best results out of your treatment, the best time to take your next dose is 7 days later at a similar time. That being said, you know, if your day changes, your plans change, or you forget, you know, it doesn't matter if you just take it as soon as you remember. With regards to forgetting, and this, you know, we get asked this quite a lot. So, you know, let's say you normally take your normal dose on a Monday morning. You know, if you run at the house and you completely forgot because you were busy, it's absolutely fine to then take the dose Monday evening when you get home. That there's no issue there. What if you forget your dose and let's say you go away for a weekend, maybe you forgot to pick it up or you've left it behind, you know, and it's a couple of days later you then take your next dose, that's also okay. You can stretch, you know, if safely you can stretch the time in between doses. The key thing to avoid, more so than stretching out, is taking doses too close together. You really want to make sure at a minimum you've got 5 days between the doses you take, because if you take 2 doses too soon, you again risk getting some niggly side effects which you don't want. However, if you take a big gap, if you're taking a gap of more than 2 solid weeks without the medication, then it might be you might need to consider maybe going down a dose or something like that, depending on where you are. If you restart again, it's all to make sure that you tolerate the medication well and that you don't get any side effects from taking it. So there are a few ways you can absolutely tweak it. And I think the other thing we get asked a lot is about storing the pens, because these are what we call cold chain medications that are stored in the fridge. So with an unused pen, an unopened pen, a medication that's not currently in use, you want to definitely store it in a fridge. You want to store it between 2 and 8 degrees. That way, that medication will last until its expiry date that's written on the side of it if it's stored at that temperature. As soon as the pens warm up to room temperature. So if you've taken it out the fridge for a prolonged amount of time and left it out, you then you then find that the window of use reduces, but not to mean you won't be able to use the medication. So with both of the pens, as an average rule, is once they're at room temperature, you've got 28 days to or a month to use the medication. So as you're taking a dose each week, that means you can absolutely continue to use that pen with no risk of it not working within that window, with no worries. So you don't have to then restore it in the fridge if you don't want to. Some people choose to. Some people do their injection and pop it back in the fridge. But if it warms up, do not worry, continue to use it. They're designed so that you'll be able to use your medication as prescribed within the window that you've got without it warming up. So yeah, without it causing issue to the medication. So you know, that's another question we get asked a lot. Okay, so next question is, how will seeing a doctor help my weight loss? Now, again, this is a really valid question because there are plenty of places you can go, fill in an anonymous, or not anonymous, but fill in a questionnaire, and the medication comes to you without you consulting or your medical history or your case being reviewed by a doctor. So there are a multitude of reasons why having the support and the advice of a doctor could really help with your weight loss on this medication. And we've touched on this already. It's not simply just about eating less. You know, if you don't make changes to what you're eating and how you're eating, how you're living your life, you're not going to get the most out of your medication, and you might not get the results you want. And that might cause you to stop, actually, instead of actually continuing on to the end and getting to that goal weight you want to. So absolutely, we can, you know, look at what you're eating, give you some advice, make sure you're getting all the nutrients you need, because your body's like a machine. Well, your body is a machine. In fact, you know, for it to be working, it's best for it to be fueled up and going, you know, burning the fat that we want to go. You've got to give it all the tools it needs. It needs good nutrients. It needs good hydration. It needs to have enough food to do those functions. So there's lots of reasons why it's important to make sure you look closely at your diet and how you're eating when you're on this medication. I think the second, and one of the other, which I think is quite a key important areas about seeing a doctor when you're prescribed this medication, is the knowledge they have about knowing who it's most suitable for, helping you pick the right one, helping you pick the right dose, and helping you navigate your way along taking the medication. You may be taking the medication and experience something different, and you think, well, is this a side effect? Should I continue the medication? And if you haven't got the support of a medical team around you, who do you ask that to? You don't want to ask Dr. Google, because you might get a load of answers that you don't know, or that might be really unclear or might concern you unnecessarily. So having that support, of having somebody help guide you and support you along the medication, I think is a really important part when you're taking, you know, these are prescription medications. They are, you know, to be prescribed and overseen by medical teams who know how to advise you best. And I think that will help you get the most out of your medication as well. And there is when we look as doctors at people's suitability for a medication, okay, we have a list of things where we know you absolutely can't have it because you've got X, Y, or Z condition, or you're already taking X, Y, or Z medication. But sometimes it's important for us to look at other factors in your health, maybe other conditions that you have that might have a bearing on whether one medication might be better for you than another, or whether we need to monitor something a little bit more closely because you've got a history of something else in your medical history. So there's lots of areas why actually having an assessment and having a discussion with a doctor could help to make sure that you get the most out of your treatment and give you that support. And I think the other thing that we know we all like when we're losing weight is accountability. Somebody checking that we are actually progressing. You know, it's that, you know, you've got that appointment, you've got to check in with somebody who's going to be asking you, how did your weight loss go? And if it didn't go well, asking you why not. You've got to show up to that, and you've got to be accountable. And I think that also helps you to stick to the plan. So again, you know, you've got that support of the doctor, and this is why, to come back to talk about our Slimming Club membership area again, it's a really good tool because you've got a community of other people who are taking this medication, who are on this sort of journey, and getting that support sometimes at those moments where you're feeling maybe a little bit tempted or not sure if you want to carry on because of something, you know, something that might be happening. You know, getting that support. Obviously, you've got the doctor side, but actually your peers, your you know, other people going through the same thing can be a really useful bit of support. So again, if you're interested in joining our Slimming Club, then we've got 60 free places at the moment. if you might be watching this already on a GLP-1 medication and wanting to find out a bit more, or you might be thinking about taking it, you might be taking another medication, you might be taking the medication elsewhere. So at the moment, we've got some fantastic offers. So if you are interested in the medication, then we currently have an offer of £45 off your weight loss pen program. So ideally, you know, whether you come to us and would like to have an appointment with a doctor to discuss, or whether you would like to complete our online prescription request, you can have £45 off that weight loss pen. So you've got lots of options there to sort of give you the choice of how you would like to request your medication, the level of support you would like alongside it, and also a way to get started. And if that wasn't good enough, at the moment we've also got free postage and packaging on our online orders. So patients who are requesting the medication through our online request service, there's currently free P&P available as well. Now, just to add, for those of you who are sort of talking about or want to know a bit more about online, again, no prescription is dispensed from our pharmacy without a doctor reviewing the information. So if you use our online prescription request and you enter all your information in, and you'll be asked some questions about you, about your lifestyle, about your medical health, and we'll ask you for some pictures to demonstrate your weight and a picture of yourself, so we can, you know, validate your ID, you are who you are. You know, all of that information is reviewed by a doctor who will make sure they're happy that the medication is correct and appropriate for you before it's prescribed. So you know, you go through that same level of rigor of a doctor approval of the medication before it gets dispensed and therefore dispatched to you as well. Great. So we've got another question from someone sent in before. It's, how do I dispose of needles? Again, really valid question. So obviously you get this medication, you get needles, a fresh needle to use every week. And it's really important you use a fresh needle each time, because as soon as the needle's been used, it's been contaminated and you don't want to re-inject yourself with it again. You want a fresh needle. When you get weight loss medication through us, injectable medication through us, you get a sharps bin too. And so that's a little specialized bin. They're usually yellow. That's where you dispose of contaminated sharps. So needles that have pierced your skin, you put them in there. Then when it's full, that sharps bin gets closed fully, so the lid can't be open, and then it gets disposed of usually by incineration. If you're a patient of ours, we are able to take that full sharps bin. We can send you a free post return envelope. We take that sharps bin back from you and we can dispose of it centrally as well. Or sometimes people dispose of it by other ways. You can take it to a local community pharmacy if you so wish, and they would take a sharps bin from you as well. But it's important the needles go in the sharps bin, and then the sharps bin's what goes in transit. Therefore, it reduces any risk of anybody else you know, touching or coming into contact with the sharp that's been pierced through your skin. But it's really important, and it's important that you use the right needle as well. We provide with our medication the right size of needle and the right type of needle for the medication you take, to make sure that you get your full and correct dose when you inject. Injecting yourself, people worry about this a lot. This is a big question, because we all think about the idea of a needle thinking it's going to be a huge big needle. It's not. The needles that come on these medications are very fine, very thin, very short. It's what we call a subcutaneous injection, so it's just going into the fat under the skin. It's not going deep down into the muscles. It's only a very short needle. You're gonna inject yourselves in areas such as the thighs or the stomach, where you can pinch a good inch, and you know, if you feel more than a scratch as it just goes through the skin, you know, I promise you it really is not a painful experience. It's the first time you do it, you might feel that's a bit strange. You've got to inject yourself, something you might not have done before, but once you've done it once, honestly, you won't find it a daunting prospect. Or, you know, you might have a family member that might do it for you. Some people do have a family member that helps them out because they don't like the feeling of doing it themselves. Again, it really doesn't matter, but they're very simple to use, they're very user friendly, and the needles are very small. So don't let a concern about the needle be a reason that you might not consider this type of medication. Brilliant. Okay, I've got one more question that we have pre-sent in, if there's no others at the moment, which is, I've heard you have to eat a lot of protein when you're on weight loss medication. Why is that? So protein is one of those, we hear about protein a lot, don't we? You go into the supermarket, everything's high in protein, fortified with extra protein. And protein is a really important food group. It's one of the three main key macronutrient food groups: proteins, carbohydrates, and fats. Really important we get protein. Protein, is what helps to build in the body. So it helps us build our muscles. It helps with the turnover of all the cells and organs and systems in the body. So it's a really important food group. And when we look to lose weight, what do? Well, we create a calorie deficit in our body, either by eating less and doing more exercise, or a combination of both, with the goal that what we generally want to lose when we lose weight is fat. We want to burn fat, get rid of the fat stores. What we don't want to do is to actually break down our muscle. We want the what we're breaking down and the calories we're burning to come from fat, not from muscles. So we know that if people embark on a calorie deficit, especially around these medications, where because your appetite is suppressed, people are often eating quite a lot less than they were before. So a considerable reduction in the amount you're eating. If you haven't got adequate levels of protein in your food, we can sometimes find that the body might actually start to preferentially break down muscle instead of fat. And we don't want that, because what you want is to be getting rid of the fat, and also muscle is what's going to help you have the physique and shape that you hope to have after you've lost weight and lost that fat tissue that's sitting above it. So we need to make sure you have an adequate amount of protein. That being said, you don't have to worry about going out there and buying extra protein shakes to take to make sure you get enough protein. No, you can always get it adequately from food sources, but don't neglect it as a food group. It's important that it's in what you eat, and it doesn't just have to be meat and fish. There are lots of vegetables, broccoli, peas, spinach that are really high in protein, as well as beans and pulses as well. So there's lots of sources, and there are things like your soy as well. There are lots of ways that you can get good protein in your diet without having to resort to taking things like shakes if you're as well. But it's really important that you get a good amount of protein. Also, the other good thing about eating protein is, because of the way protein is made, the molecule, it takes a little bit longer for the body to digest and break down. So again, it helps with you feeling fuller for longer, and also it helps to release its energy a bit slower. And as a good rule of thumb, again, when losing weight, we often recommend that you eat a bit of protein with a bit of carbohydrates, because proteins help to slow down how quickly the carbohydrate gets broken down as well. So again, it's all about managing how the food's released into your body and the calories that you're getting from what you eat. So it is really important. You must have it as an important part of your diet. As important as you must have carbohydrates. People worry about carbohydrates. Some carbohydrates get a really bad press when people are losing weight, but your fibrous carbohydrates, your gut will thank you for eating, especially on this type of medication. And fibrous carbohydrates are things like your fruits and vegetables that are a big source of fiber, but also your whole grain varieties of bread, of pasta, rices, again, pulses, beans, all those things that are fibrous, that are important for the health of the gut. They also make you feel fuller when you eat them, because naturally they are a bit more fibrous, so they fill up the gut. And we know how important that is for our gut health, and we're seeing a lot more medical information coming out about how important gut health is, not just to overall health, not just to mental health, but also to helping with weight loss as well. So making sure that you're getting a good load of your fibrous carbohydrates is key. And we won't forget them fats. Healthy fats are really good for us as well, and should definitely be part of your dietary plan. Whether you're, don't be afraid to have your olive oils, your avocados, again, nuts and seeds. These are all sources of really important and healthy fats that help to they help with the health of every cell in your body, help to manage the structure and the health of each cell. And again, we know a lot that when people have been overweight, and we've been overweight for a while, sometimes our cells can begin to become unhealthy and actually become a bit pro-inflammatory, and we don't want that. That's not going to help us with weight loss. So again, healthy fats can help especially your omega-3 fats, which are really important to get from your diet, again, can help to make your cells healthier and happier. healthier and happier body is going to lose weight better and work better for you. So again, these are all really important things. And this is the sort of knowledge and not knowledge, the sort of information and support you can get by attending an appointment with one of our doctors. We have a great dietitian support as well, who can go into, again, even more detail with you about that. But also these sort of broader messages and broader ideas and talking about the food groups, recipe ideas, etc., is all part of the support that you can get through our membership area, the Slimming Club as well. So, you know, if you want to get in there before everybody else, take these first 360 places and you can, you know, see the sort of resources and support that we've got for you there. So we've covered a bit this evening. I think, you know, whether you're on GLP-1 medication or you're thinking about it, it's as a tool to help you manage your weight and make this the last diet program you want to do, get you to that goal weight. They're a fantastic tool. Make sure you're optimizing it by making those changes to those other really important areas. You've got diet, you've got mind, you've got movement, you know, and you've got your medication. So you've got your support pillars. Make sure you've got that support around you to get the most out of that medication. And there is a value to having the support of a medical team around you as well, to make sure, again, that you're getting the best out of the medication you're choosing and you're on the right one for you. So please do, you know, have a look in the comments. So if you want to go forward with medication or you want your next dose of medication, we do have the offer at the moment of £45 off weight loss pens. So do consider that, as well as free P&P, so postage and packaging for online orders at the moment. So thank you everybody who has joined. I can see I've had you know, people joining me this evening. Just now, if there's any question, go for it. But if not, you know, if afterwards you want to put a question in the chat, then do go ahead. Here we go. We've got Gillian Trimble. My GP doesn't agree with weight loss medication. They prefer diet and exercise. Do you have to inform them? Okay, that's a good question. So I find that's saddening to me that the GP doesn't agree with weight loss medication, because this medication, you know, we've seen the fantastic results that patients are having in terms of weight loss, and we know that achieving weight loss and reduces the risk of so many other diseases in the body. Not only does it make you, help you feel better, but your risk of certain cancers, of heart disease, of diabetes are all reduced. So I find it saddens me that your GP feels that way. Now, sometimes some clinicians might suggest, well, try with diet and lifestyle changes first before you consider medication, to see if, you know, you don't need it. But absolutely, there is a good place now for medication. It's within the NICE guidelines, which are the guidelines that clinicians and doctors use to guide them on what are safe and correct treatments to give patients. So do you have to inform them? So the choice is yours. If you're sourcing your medication in the private sector with a company like ours, the choice is yours. No one forces you to inform your GP. That being said, your GP is obviously your main caregiver. They're the ones who are going to manage any other conditions or illnesses you may have. So sometimes it is valuable for them to be aware that you are taking it. They certainly can't stop you getting the medication from a reputable provider such as ours, or from a legitimate pharmacy. So the choice is yours. I think what we discuss it with you at the point of starting. We can inform your GP directly if you should so wish, but no, you're not forced to tell your GP anything. It's your treatment. It's, as long as you understand that, if it could be important to disclose it if you potentially fell ill and you ended up in hospital. If you were talking to a doctor there about the medication you're on, it would be important to tell them, because they would need to know that. But no, you don't have to tell your GP. But again, the more people who give you care that know about it, the better. But yeah, you can, the decision is yours. And great question. Thank you. Another one here, Karen. I successfully lost weight with Wegovy, reached my target, and then was not be able to be prescribed anymore. Appetite came back with abundance. Should there have been a maintenance dose? So with Wegovy, which again is the semaglutide version, it is licensed for weight loss and then also maintenance for about 6 months or so. So again, what can happen sometimes is you go from taking the highest dose medication, then you stop it, and you almost go cold turkey in the sense of your appetite coming back. Now, along your journey, and I'm sure you did, you will have noticed or become, you would have found out about portion size. You would have been eating a lot less. So, but that being said, I completely understand, Karen, the appetite comes back and these things and can start to peter in. So I think there's two things to think about. Number one is when you come to your target weight and where you want to go is to, again, talk to your doctor about how you're going to manage that. Maybe you would actually go down to a lower dose of the medication for a while just to kind of see how they go. But the thing that we tend to say to patients is, obviously, we're going to learn all the changes that hopefully that you will be able to continue and maintain after you've stopped the medication. But we know, we understand that sometimes things happen and weight does regain. And what's important is to take action early at that stage. So if you notice that your weight is slipping back up because your appetite's coming back, that's the time to reapproach whoever you had your treatment with, whether it was us or elsewhere, to talk about what your options are, because you've done all that hard work to lose weight to a level. Now, at the moment, the medications are not authorized for ongoing or lifelong prescription, so you do have to stop them. But how you stop them, whether you titrate the dose down first, all of those things, are very personal to each person, and again can be absolutely discussed when you get to that point. But it's again, we there's a fantastic database that's actually kept in America, but of patients who have lost a significant amount of weight and have kept it off. Now, actually, a lot of these patients didn't use medications because actually, when this database is spanned from, these medications are relatively new. But the common pattern, they survey these patients every year to find out what they're doing to help keep their weight on target. And some of the things that we know that they all have in common are they remain accountable. So they never stop checking their weight. Now, that's not to say you should weigh yourself every day, but whether it's once a week or once a month, they make sure they stand on the scales or they notice their clothes size is going up. Keep accountable to it. Don't sort of let it slip. But also they have kept up a level of movement. Now, that isn't anything vast or crazy, but they've kept up a level of movement, making sure they're doing that sort of 20 minutes of movement or exercise across the week. So we know that some of those things that are really key to helping maintain the weight you get to are really important, that we ensure that you kind of put in place as you go along your treatment, which again, is why using like the membership resource or appointment with the medical team can help to arm you with those things that we know can really help. I'm suffering along with terrible headaches with burps. Okay, yep, no, great. Two things that are coming up a lot. So in terms of burping, that is a side effect of the medication. Again, it's because the way the medication slows down the food moving through your stomach, therefore food staying in your stomach for a little bit longer, and that can make people burp a bit more, or some people get a little bit of indigestion. So sometimes it's worth looking at what you're eating or the amount you're eating in one go. Sometimes it could be better for you to eat smaller and more often if you're struggling with that as a side effect, or looking at what you're eating to see if there are certain things that you're eating that make that worse for you. Again, there are sort of certain types of fruits and vegetables that can sometimes create a little bit more gas, again, that can make you more prone to that. So it's a bit of a tandem of those two. Hair loss, it has been reported in the literature, and we're seeing people reporting hair loss when it comes to the GLP-1 medications. Now, the medications themselves don't cause weight loss, but what we are seeing and what we understand is that the way these are working and the way that people are losing weight at good levels actually creates a little bit of a stress response in the body, because our body, although losing weight is never a bad thing, it doesn't want you to rapidly lose weight, because it worries, for that sort of, if we think about that caveman fight or flight, we don't want to be losing all our sort of stores all at once, and it creates a little bit of a stress response, and that stress response has an effect on the cycle of hair. So hair goes through different cycles in your head. It goes through sort of a growing phase, a resting phase, and then almost a dead phase. And actually, when that stress response happens, it pushes the hair into the dead phase a lot quicker. So then the hair falls out. So we're seeing that it happens now. That's one reason. The other reason, again, I touched on this earlier, is when people are eating less, and sometimes considerably less, they're not getting enough of all the key vitamins and minerals that are really important, because we're eating so much less. You almost don't have enough room to eat enough to get that whole variety. So again, making sure that you're taking a good multivitamin alongside your diet is really important, because sometimes things like your zinc, your selenium, things like that can be missing from the diet, which again can have effect on the hair. That being said, we know it's only temporary. The hair will grow back. It's not a permanent thing. You won't lose your hair indefinitely. So again, it's looking at actually what you're getting in, making sure you're getting nutrients, and looking at the rate of weight loss. Now, obviously, we want you to continue to lose your weight, but if it's going quite rapidly and quite quickly, then again, that might be something to look at in terms of making sure that your body's getting all the support it needs. So, so I hope that answers that for you. Okay, thank you very much. Thank you for those questions. It's really good to hear what everyone's experiencing, and thank you for those that sent them in before. If you haven't asked your question now but you think you might like to, or you're watching this later, then please do put the question in the comments and we will endeavour to get back to you with regards to that. But if not, I'd like to thank you very much for joining me this evening. We're going to keep doing these lives at a regular pace moving forward. So if you found this useful, then please do keep your eyes peeled for further lives, to come and join us and to get involved. So yeah, thank you everybody for joining me this evening, and I hope everybody has a lovely evening. Thank you very much.